The big message is we've got to stop the stigma about this. I mean, it's nowhere near as bad as... Remember in the 80s with all those crazy iceberg adverts and everybody... It was disgraceful.
Things have changed so much with the treatment of AIDS, and we need to get rid of this stigma. It's awful, and Theresa May herself said it's an unacceptable stain on our society and we have to wipe it out. And they've got a new poster campaign for World AIDS Day, which says, you know, HIV stigma, not retro, just wrong. And it is completely wrong.
Exactly.
A YouGov survey surveyed 2,000 people, and still 20% of people think you can catch it from kissing.
What, seriously?
Seriously.
Even
30% still think in this day and age that you can catch it from sharing a toothbrush with someone who's HIV positive, and 10%, get this, think that going to the hairdressers and having your hair cut with scissors and clippers used by someone...
we've got a long way to go. We've still got a long way to go. I mean, we're getting better, but really,
yeah, it is slow. On the other side of things, that we've targeted high-risk groups who have not been undiagnosed before, but we're still missing out on those undiagnosed groups that consider themselves at low risk. So menopausal women, I mentioned earlier, postmenopausal women, we're seeing about 16% increase last year.
Really?
Which is 300 women.
Now, why is that? Is that because they're not taking precautions?
They're still sexually active, but they don't take barrier contraception.
Oh,
and of course, they're not using fertility and maternity services where routine testing is done. So they're missing out. They need to be aware.
Well, so we all have to be aware. Absolutely, everybody has to take responsibility for their own health, don't they?
And testing's never been easier. I've got a home test here, which is so easy to use. You can buy these online. This one's from BioSure. And you simply take a finger prick test, a drop of blood from your finger.
And that will tell you right away?
And you mop it up, and it'll tell you within a few minutes whether it's positive or negative. Now, obviously, you're not getting counselling when you do that, but if you get a positive result, you're to go to the healthcare professional, get it confirmed, have the counselling, have the treatment. Because treatment these days is completely revolutionised.
No, of course it is. It's absolutely amazing, but you do have to get counselling as well, I would think, too. Just, just to help you out.